Hi everyone, welcome to today's presentation. My name is Simon Workman. I'm the principal and co-founder of Prenatal to 5 Fiscal Strategies, and I'm joined by my colleague Kristin Davis. We're going to talk to you today about the true cost of childcare in Connecticut. So, as I mentioned, we are with Prenatal to 5 Fiscal Strategies. We're a national nonprofit organization that is focused on addressing really the broken fiscal and governance structure within the whole Prenatal to 5 system and very focused on childcare and home visiting and early intervention as three key components of that system. And our work happens across the country. We work with states and communities across the country to advance this idea of really centering children, families, providers, and the early childhood workforce in how we rethink this system to make it work better for everyone. And we've been very lucky to have worked with Connecticut over the last few years and happy to be able to share with you today some of the most recent work that we have been doing with childcare for Connecticut. So we're going to start with just a little bit of an introduction to what we mean by the true cost of childcare and introducing the work that we're going to share with you today around the true cost of childcare at the provider level in Connecticut, as well as at the system-wide level, at the statewide level. So as I mentioned, we have been working in Connecticut for several years now. We helped the Office of Early Childhood to complete the narrow cost analysis, which is a requirement of the Federal Child Care Development Fund, which is part of the funding that supports your Care for Kids subsidy program. And as part of that funding, states have to complete either a market rate survey or what's called an alternative methodology using a cost model, and as well complete what's called a narrow cost analysis so that states can really understand not just what providers are charging in the market, the prices they are charging families, but also what it actually is costing providers to operate care. So we developed a cost model to inform that narrow cost analysis in 2024. And then for this project, we are using that cost model with some adjustments that we'll talk about in a moment to help understand the true cost of childcare in Connecticut aligned with the goals of the coalition. In addition, in order to understand the what we call the big number model, what is the cost across the state, so not just at the individual provider level, but what would it cost to actually provide access to affordable childcare all across Connecticut, we created this big number model, which takes that cost per child numbers from the direct service model and adds some demographic data and some population data to estimate what does it cost to provide universal childcare in Connecticut? And we worked really closely with the Childcare for Connecticut's Future leadership to look at the assumptions that go into that model and then make modifications so that the numbers that we're going to share with you today are reflective of the coalition's goals. So I've used the term cost estimation modeling or cost modeling a few times now, and just to sort of clarify what that means, the cost estimation modeling is really about building a tool. In this case, it's an Excel-based spreadsheet that can estimate what it costs to provide care that meets the requirements, whatever those requirements may be, right? So there's subsidy requirements that are, in order to be a subsidy provider, you have to meet certain requirements. There's also requirements related just to being a licensed provider and operating a healthy and safe environment. And so the cost model takes a look at what are all the resources that are needed to actually provide that level of care and adds them all up together and uses this tool to sort of say, this is the actual cost of all those things and meeting those requirements. And obviously personnel is a huge part of that, not just what are you paying educators and people in the building, but also what are you how many have you got, right? How many teachers do you have in the building? How many administrators do you have in the building? How many assistants, floaters, etc. So one of the things that's really important in the cost estimation model is, not only the materials you need, the food, the occupancy, but also, how many people do you need in order to provide that high quality care, right? In order to do the things that are required of a provider at different levels, how many people do you need? So that's a lot of the work that goes into the modeling is really understanding the time as well as the material resources that you have. And then what the cost model can do is it allows you to look at how does the cost of care change based on different choices you might make. So the cost of care is different for a program that is serving 30 children than a program that's serving 300 children, right? There's some economies of scale that come by that larger program. Similarly, the different ages of children served has a big impact. If you serve infants, toddlers, preschoolers, school age, that looks very different from if you only serve preschoolers or if you only serve infant toddlers. And the cost modeling can help you understand the fiscal impact of those programmatic choices that are often a choice by the individual program, but they're often also impacted by policies at the state level or the federal level, right? So if there is a policy that moves a lot of 4-year-olds into public school, we can see what the fiscal impact that has on childcare providers and what impact that might have on the cost of care for infants and toddlers. There's also lots of other things you can do with the model, understanding the geographic differences in the cost of care, understanding what it looks like if your program is full or if you have empty slots. You're still paying for the teachers, even if you have an empty slot. If you're not collecting all of the expected revenue, the bad debt, to help programs at the program level understand the impact of certain business decisions they might make on actually their ability to, be a financially sustainable program. The model can also be used to look at current revenue streams to understand what is the current funding that is available to cover that cost of care. So you have a cost of care, then you say, okay, what is parents able to pay? What is public subsidies, public funding able to pay? And is there a gap between the estimated cost and the estimated revenue? And how does that gap differ by population, geography, type of care, etc.? So overall, then the models can really be used to help understand, both at the policymaker level, the impact of their policies, as well as at the individual provider level and at the advocacy level, really understanding not just the sort of simple answer of what is the true cost of care, but how that cost of care really differs by different characteristics. And so, as I said, we often are doing this modeling for policy development, understanding what subsidy rates should be or what other financial incentives might be. So if you pay a higher rate based on, higher quality, is that rate actually enough to cover the cost of higher quality? Or if you're paying out quality incentives to encourage people to improve their quality of their program, again, are the incentives sufficient enough to cover the costs of the higher quality? Can also be used to help programs understand how to operate as a better business, right? And be as efficient as possible with the resources they have. So understanding the impact of, keeping on top of your wait list, making sure that you're as full as you can, as often as you can, and really thinking about how the cost data can inform, some of those business practices and understanding the fiscal impact of making certain changes to your program. And then on a statewide strategy, really looking and saying, what are our goals as a state for moving this field forward? And, what are the different costs, both the big costs, but also costs of, steps along the way to get there. And then on the advocacy side, the model's really helpful to educate people. So many times we get asked the question of, why does childcare cost so much, but teachers make so little? Like, where's the disconnect? Where's the money going? And the modeling can really help policymakers, but also parents and the general public understand the finances of a childcare program, the finances of ECE, and understand how personnel is a big primary cost driver, understand what happens when families are paying, lower prices than our model will tell you the cost is, who is that actually impacting? And, usually it's impacting the providers and the educators themselves, who therefore are getting paid low salaries because there's not enough money in the system, both from the public funding or from the private funding that families can afford to pay. And so then from an advocacy point of view, it can be used to understand what level of increased public investment might be needed, right? Understanding the inadequacy or adequacy of the current funding streams and how that differs, and really understanding the difference about who needs support to access childcare. In a world where we look at, the current price of childcare, looking at who needs help to cover that cost, is very different than if you look at the true cost of childcare and some of the numbers we're going to show you today. Look at that true cost of childcare and say, okay, which families now need help covering that cost, right? It's a little different when when we're looking at the true cost of childcare than when we're just simply looking at the price of childcare. So now I'm going to pass it to Kristin to talk about the results, the work of the direct service cost model, and some of the results that came out of the cost model.
Thanks, Simon. So, as Simon mentioned, we're going to talk a little bit about some of the assumptions that we use for determining the direct service cost model. And we began by looking at the workforce compensation mid-year as our salary floor base. It was able to just give us a baseline to set salaries at. We know that personnel expenses are one of the largest share of a child care program's budget. And so the salary choices made are one of the most significant drivers of cost. We also looked at setting the capacities for all of the makeup of the programs. So the center capacity was set at 78. Group family child care homes were set at 12 with the inclusion of 4 school agers, and a small family child care was set for 9, including 2 school agers. We also looked at the makeup of staff. The center makeup includes a director, an assistant director or educational coordinator, and and an administrative assistant. The family child care includes the provider themselves, and the group family child care includes one additional full-time assistant. We also looked at a few of the licensing levels. So the base includes all the assumptions of all running legally operated programs and meeting all training requirements. For centers and group family child care, that is 6 hours of first aid and up to 21 hours of professional development. Small family child care homes have 6 hours of first aid and 10 hours of professional development. This also includes health insurance and paid time off, which are built into those salary benefits. Some of the additional enhancements that we looked at was family engagement, 2 hours per child annually, which really equates to teacher and parent meetings that they're able to have discussions about the child's development. We also looked at planning and release time, so 1 hour per week for lead teachers and assistant teachers. And for family child care homes, it would assume the provider or owner themselves will get that extra hour. Some inclusion supports are inclusive of 250 per child for IFSP or IEP, which is the Individualized Family Service Plan or Individualized Education Plan for materials yearly. And it also looks at the potential to have an aid. So this is really the base of the foundation that the direct service cost model was built on. Next, we're going to talk a little bit about some of the salary data that was included. So some of the salary data is used to determine the assumptions for for understanding what the salary costs are. This cost model included 2 salary levels. The first one uses data from Connecticut's workforce registry, which reflects current salaries, and the second is the higher compensation option to better understand the true cost of care with higher compensation. For this data point, the model uses data from the workforce compensation schedule. It's based on the mid-year career placement. Because that compensation was completed in December of 2022, it is accounted for inflation so that we understand that those figures are increased for that change. For the cost model results in the scenario we are talking about today, the salary assumptions in the second column, which are highlighted in red, are used so the scenario represents the true cost of care with higher salaries. As you can see, under the scenario, the lead teacher's salary is set at $72,753, with assistant teachers at $52,720. On our next slide, we're going to talk a little bit about the results and understanding the annual cost per child. These results, as you can see, that in a child care center, the cost of care is higher for younger children, which is due to the smaller ratio and group sizes in classrooms for younger children. The school age cost per child is the lowest, which reflects two things. First, that the ratio in group size is the highest of all the groups because older children need less adults for supervision. Second, the school age rate reflects a schedule that includes full time care during school holidays and a part time schedule during the school year. In the group family child care and family child care home scenarios, the program operates essentially one classroom. There are not age specific cost difference driven by the ratio requirements. However, programs are limited in the number of infants they can serve. So a program could not only serve infants, for example, without additional staffing. In our scenarios, the Family Child Care Home program is assumed to serve a mix of ages with only two infants in the small family child care home and four in the group family child care. We know that in the market, providers often charge a different rate based on age. But for the purposes of this cost modeling, the model produces the same rate for these age groups. For school agers, the rate is lower because just like in centers, the annual school age rate accounts for the part-time during the school year and full-time during the school breaks. I am now going to turn it back over to Simon to talk a little bit more about the big number cost model.
Thanks, Kristen. So the numbers that Kristen just shared on the slide are the cost per child numbers that are then used when we are talking about what we call the big number cost model, which is the attempt to estimate what the cost would be across statewide if you were actually providing care at the rate that was listed on the prior slide from the direct service model. So, looking at what would it actually take if infant care in a center cost $39,000 per year, and if there was actually the resources available to compensate providers at that level for every infant that they have in their program. Now, I will note that the cost per child numbers are statewide average numbers because of the fact that the compensation scale is a statewide number. So it is an average. And when we talk about this big number cost model, it is an average, right? This is a model that is attempting to give you a sense of what the cost would be. There'll obviously be some nuance to that and how it might vary a little bit by region and specifics of, smaller programs, larger programs. But as we discussed in that direct service cost model section, we used an average size of a program based on the data in Connecticut, in a program that's serving infants, toddlers, preschoolers, and school age to really understand, a best estimate of the cost to use for this big number cost modeling. So just like in the direct service model, there are several assumptions that go into the big number cost model. The first is thinking about who are the people we want to serve, right? If we're talking about universal childcare, what is the definition of universal childcare? For the purposes of this model, we are focused on the birth through 5 population and not focused on school age. So all of the costs in this section we're going to talk about are just for birth through 5. The population based on census data of children birth through 5 in Connecticut is just under 217,000. You see that there, 216,858. We do assume, in addition to that, that about 2/3 of 5 to 6-year-olds are in kindergarten. So we account for 1/3 of 5-year-olds being in our estimates because they're still in childcare, but 2/3 of them would have aged up and gone into kindergarten. So that's just a bit of a nuance to the numbers there. Then when we talk about universal, we know that in no situation of a universal program do 100% of the eligible population actually take it up, right? We know that not 100% of 5-year-olds go to kindergarten. In the states and cities that have done some version of universal preschool, we generally see about 80% of the population being, the sort of high watermark of the families that opt into that. It's a little bit different for infants and toddlers. There are not many places that have really looked into universal infant and toddler care just yet or have implemented it. So there's not as strong data as there is on the preschoolers. But in discussions with the group here, we landed on a population saturation of 50% for infants and toddlers. And that reflects the fact that, with paid leave, with parental leave, either paid or unpaid, several a percentage of the infants will be home with families. And then just knowing that many families also find a way to, take a work break to care for infants and toddlers and maybe opt out of the formal childcare system. So these assumptions that we're looking at today assume 50% of that population for infants and toddlers, 80% of preschoolers, which means you need a total of 104,926 childcare slots across the state. The next piece there is how are they distributed across those three program types. So we were able to look at the data currently 90% of your childcare capacity in Connecticut is in childcare centers, 9% is in small family childcare homes, and 1% is in group family childcare homes. So, in the absence of other data, we carried that distribution on to that 104,926 slots. And so what you can see in the table there is what the distribution of capacity under this universal childcare scenario would be by age and by setting. So you'd need about 94,000 slots in centers, 9,400 slots in small FCC, and just over 1,000 slots in group family childcare. Again, this model is not sort of prescribing that's exactly the way it would need to be if you implemented this in Connecticut, but this is important for the cost estimate. So what we end up doing in the big number model is you take that sort of 16,264 infants and toddlers in a center, and that is multiplied by the infant and toddler cost per child, right, to get as part of informing the big number. So, that's the way the model operates. And if slots moved around across them, that's okay. We're looking at sort of the best estimate based on these assumptions. The other assumption that's built into this is accounting for family contributions, because obviously that is a significant increase in the number of slots than are currently funded under public funding in Connecticut. So, as part of the goal around universal is universal affordable childcare. So then the question becomes, how are you defining affordable? And based on the Federal Health and Human Services definition of affordable childcare as being families paying no more than 7% of their income, we built this sliding scale for Connecticut. And the assumption here is that childcare is 100% free for families up to 300% of the federal poverty level, which is about $78,125 for a family of three. And then there is a sliding scale contribution above that. So what you can see in the table there is that it works up that if you're between 3 to 400% of FPL, you're paying 3% of your income, which is around about $3,200 per year. If you're 400 to 500% of FPL, it's 5% of your income, or about 7% of, or about $7,000 per year. And if you're over 500% of FPL, it's 7% of your income, which, at that lower level is about $12,000 a year, but obviously could go up. And obviously you'd get to some point where 7% would equal the cost of childcare and where essentially you would not be getting a subsidy, or you'd be getting a very small subsidy. So in this way, you are looking at the true cost of care, that you are asking families to make a contribution up to a defined level of affordability. And what you can see there, generally families right now are probably paying, $2,000 a year, a month on childcare. And what you see here, it's only when you get to that over 500% of FPL that you're paying, $1,000 per month in that annual copayment. So let's now look at how all of this comes together into results. And so what you're seeing here on the screen is the annual results of that big number model. And just to walk you through it, the first line shows you that direct service cost is $3.1 billion. So 3,169,000,000. You can see all the rest of the numbers there. That is the, total cost of serving that 104,000 slots at those true cost of care numbers. In addition to that, that's just the direct service cost. We know that in addition to that, there has to be some support at the state level and at the local level for the infrastructure, right? So the monitoring, the licensing, professional development, providing other quality improvement supports, administering the subsidy system, et cetera, et cetera. A good rule of thumb is to use about 8% for that, 8% of the direct service cost. That is sort of national default that gets used in a lot of this modeling without having to sort of go deep into individual budgets. So that's the default we're using here. So that costs about another $253 million. But then we need to add in those family contributions we just talked about. So we were able to look at data on the income profile of families with children in Connecticut. And based on that review of that data, we made assumptions about how many families of that 104,000 slots are at different levels of income, and therefore what they'd be paying family contributions. And that comes out at about $542 million of family contributions. So you take that direct service cost 3.1, you add on the infrastructure, and then you take away the family contributions. That means there's a total public investment needed of about 2.8, $2.9 billion, which is obviously significantly more than is currently put into the system. But that is the result of looking at the true cost of care, what it actually costs to run a childcare program with a much higher wage, that workforce compensation scale for the educators, looking at a universal system where you are reaching 80% of preschoolers and 50% of infant and toddlers, no families paying more than 7% of income, you would need public investment of $2.88 billion. So now I want to take a moment to put this into some context and share a few comparisons. The first thing I want to share is how those direct service cost per child numbers compare to the current subsidy rates and how that looks different. As you recall, we talked about how you can use the model to understand the gaps and how the gaps look different in different circumstances. This chart you're looking at now is the gap, the annual gap per child in a childcare center between what we are estimating as the true cost of care and what the Care for Kids subsidy rates will pay, right? So if you are currently eligible for subsidy, looking at the rates effective July 1, 2025, when some new rates come into effect, looking at the rate for full-time care, we took that rate and then we took the cost per child number and said, what is the difference in cost? As I mentioned, our cost per child numbers are a statewide average, but then you also do set your rates in Connecticut by regions. You have the East, North Central, Northwest, South Central, and Southwest. And so we compared the cost number to each of those 5 regions, as well as to an average subsidy amount. So the first bar that you see in each of these groupings is that statewide average, and then the rest show you the regional differences. And going across the chart is the different ages of children. And so what you see immediately visually is, take a look at the axis on the left, and that's all negative numbers, right? So in all cases, the true cost of care is higher than the current subsidy rate will cover. What you then also see is the direction of the bars, right? For the younger children, for infants and toddlers, they lose a lot more money per child. There's a much bigger gap per child than there is for the preschoolers and the school age, right? So there's a gap for everyone, but the gap is much bigger for younger children. And that's really driven by those ratios and group sizes being really smaller for infants and toddlers, which is so necessary for quality care. But families really cannot afford the true cost of infant and toddler care. So the market rate ends up being much lower than the true cost compared to school agers where families can afford closer to the true cost of care. And so the market rate is therefore closer to it. And because subsidy rates are based on market rates, that's why you see these numbers sort of reflecting what happens in the market. The other thing I want to draw your attention to is the regional differences. So what you see is that first bar, if we just look at infants, that first bar, the statewide average cost compared to the statewide average subsidy, you're losing about $18,000 per kid. There's a gap of $18,000 per kid. But if you look in the East region, that gap is now $23,000 because the subsidy rate in the East region is lower than the average statewide. Same for in Northwest, that fourth bar along there, your gap is about 21,000, 20,877, right? So those are the two areas, the East and the Northwest, where the gap is biggest because the subsidy rate is lower. In the Southwest, the gap is smaller, right? That's the smallest across all of these, where it's only 12,401, which is showing that the subsidy rate is actually closer to the true cost of care there. Now, of course, you can do a sort of deeper analysis and actually look at what the cost of care would be different by region, but then you really have to understand what the different costs are per region. And because personnel is the largest cost driver in this model at about 70% of the cost, and because we're using a single statewide number for the personnel values in the model, that's why you aren't seeing a different cost there. But you can immediately start to see here where the gaps are bigger, right? So if you were starting to think about increased public investment and targeting that increased public investment, you can see where targeting it to infants and toddlers, is where that gap is largest. Targeting it, if you're going to target geographically, that east and northwest are where the gaps are the largest, and you might consider targeting. There are similar charts here then for group family childcare. And what you see in group family childcare is sort of similar in terms of geography, but a little different in terms of age. And just to sort of take a moment to talk about that, that's because in both of the family childcare scenarios we have, there is no classroom, right? It's basically one single classroom. So you don't have ratio and group sizes driving the cost differently. In centers, you have, two teachers, but eight infants, or two teachers and, 14 or 16 preschoolers. In family childcare, it's, the one provider owner in a small family childcare home and a provider owner and a assistant in the group family childcare home, and they're covering all of the children in that program. So from the chart, it looks like the gaps are smaller for infants than they are for preschoolers. And they sort of are based on the cost model, but the cost model is an average across those ages of children, right? You could not serve only eight infants in a program, right? If you did, you'd have to have more staff, and that would change the cost per child. The cost model assumes this range across there. So, in some ways, it looks like the cost is, closer to the subsidy rate for infants than it is for preschoolers. And that's because most family childcare providers actually do charge a different rate for infants, toddlers, and preschoolers. But again, that's driven by the market and not driven by the true cost of care. It's a policy decision from a state as to whether you're going to reimburse at different rates under a cost-based approach based on age. There are ways you can sort of build in an adjustment for that, but the true values coming out of the cost model just have a single number there. But as you can see, there's still a big gap, right? This is the group family childcare. You still have a gap of, 12 to $18,000 per year. And then this one, next one now with the blue bar shows the gap for family childcare homes, where again, the gaps are, 11, 12, $15,000 per year between our estimated true cost of care and the current subsidy rates. And often people sort of ask us, well, how is that possible? How are you saying there is such a big difference between the cost and what the subsidy rate is currently covering, like how our business is operating? Well, that's where you have to recall the assumptions that go into our true cost number. Our true cost number includes those higher salaries for educators. It includes some paid planning time. It includes health insurance. And the reality is on the ground right now, because of these gaps we're showing you, that's why programs often can only afford to pay minimum wage or just above minimum wage. They often don't provide health insurance. They often aren't able to have the robust staffing that you really need to run a well operating program. And so those gaps are being filled by the program operating, working more hours a week and not being able to compensate educators at the level that they both deserve to be compensated at and also need to be compensated at in order to recruit and retain quality teachers, which is why we see such high turnover in early childhood all across the country. So then the final piece I want to do is just put a bit more of the context. Obviously, that 2.9, $2.88 billion number is a big number and is significantly bigger than the current public investment in Connecticut. But I think it's useful to put it in context of what this looks like to the overall GDP of Connecticut and other examples. So 2.88 billion is about 0.79% of Connecticut's gross domestic product, right? So, it's a very, very small part of the overall economy. Yet we have other studies that show the significant impact that investing in early childhood has on the economy, right? So, I'm not going to get into it today, but there's a whole wealth of literature out there to help understand, if you move to paying educators $72,000 a year, where does that money go? That money, a lot of that money goes back into the local economy that those educators live in and are spending in, or it lifts them away from poverty and takes some of the burden off of the other public support systems that those caregivers are having to rely on. It's also not a sort of crazy number in the context of, other states and other places that are looking into this work. So the OECD average, so that's a group of countries, looked at the investment in early care and education across the OECD countries. And the average investment in early care and education across OECD countries is about 0.8% GDP. So right around where our numbers are recommending for Connecticut. Currently in the US, we invest nationally about 0.4% of GDP. So we're a lot lower than the OECD average. But what this model is talking about is actually going to get you at about the OECD average. And then I'll also just point out there was a study a few years ago by the National Academies of Science and Medicine that did a study on, it's called Transforming the Early Care and Education Workforce, and looked at sort of a similar effort to what we've talked about today of, what would it cost to have a robust early childhood system in the United States where you were paying people better, etc. They obviously made some sort of different assumptions to we did, and it was a few years ago, but they came up with a number of about $140 billion, which at the time was equivalent to about 0.75% GDP. So yes, 2.88 billion is a big number. I don't want to sort of shy away from that, but it's also not it's not completely out of left field in terms of when we look at the countries that are investing well in this and other studies that have looked at what does it actually cost to well invest in early childhood. It is about 0.8% of GDP, which in Connecticut is around $2.88 billion. So thank you for joining us today. I'm very happy to have had the opportunity to share this data with you. We have lots of resources about this type of work on our website that you can see on the screen, which if you are interested in this work, we encourage you to check out. Thank you.